Thank you very much, Fatima. Good afternoon, everyone. It's a pleasure to be here with you this afternoon, and I was really excited to be speaking about citizens experts and the activation of citizens and members of the public in our health agenda. And although the lineup has changed and I'm presenting at the end of the session, it's actually great because we're going to be moving from the specific, and we had some great examples from previous presenters, to the general. And what I want to cover today is how we are incorporating citizen health experts in our work in Public Health England. Now, some of you may be aware that, certainly from my own background, I've been working with citizen health experts related to HIV/AIDS for many decades, for the past 2 decades. And in this job in Public Health England, I'm in charge of the non-communicable disease prevention portfolio at PHE. So I cover tobacco, dementia, mental health, sexual health, and HIV, a range of health topics. And citizen health experts, public engagement, asset-based approaches, place-based approaches to engaging individuals and communities in health are fundamental to the work that I do in PHE. So what I want to do today, very briefly, is just share a little bit on why we need citizen health experts and why this is such a core part of PHE's ethos. Second, I'd like to perhaps revisit some of the theory and where we are in our understanding of engagement and the role of citizen health experts. And then I'd like to end with some concrete examples of ways in which we're adopting and integrating this approach in our work in Public Health England. Now, from where we sit in PHE, we are having to deal with a range of health challenges, health opportunities, but also to think strategically about how we encourage and support the nation to respond. So there are major challenges up ahead. We're living longer as a nation, and as you know, over the last 2 decades, we've seen significant increases in life expectancy. And in fact, the United Kingdom has seen some of the largest increases in life expectancy across Western Europe, and many of these changes are due to improvements in cardiovascular disease, management of stroke, and of cancer. So we're doing much better at lengthening life. But the big challenge that we have is that we are spending more of these years in ill health. And that is because a number of treatments are prolonging the way individuals are living and having multiple conditions, multiple morbidities becoming a key feature of these years of additional life. Now, not only are we seeing longer lives, but longer lives in ill health, but we're also seeing big challenges with worsening inequalities across the country. And in fact, over the past 2 decades, although all parts of the nation have improved in terms of life expectancy, we know that the differences between the most affluent and the least affluent in society have remained relatively unchanged. So everybody's improved, but we are not cutting into into the inequalities. And we know that not only for life expectancy, but for a range of health outcomes, we're not only speaking about differences in behaviors, but a range of social and structural determinants which are at the forefront of driving these inequalities. And some of these are highlighted here. A focus on good employment, higher educational attainment, creating safe and supported and connected communities, focusing on housing and the homelessness issues, social isolation, exclusion, and loneliness. So when we think of the work that we need to be doing as a public health agency, we need to take both a broader approach, which focuses on the determinants, while focusing on the most effective interventions to help to tackle the challenges. So it's within this context that our focus on citizen health experts has become critical for work in Public Health England. And we need citizen experts not only as advocates to argue for investing more in prevention as part of the overall health budget, which currently is at 4%. We need citizen health experts to help us to tackle some of the behaviors which are driving non-communicable diseases or other health conditions, so that activation of individuals to be part of the solution and not have things being done to them is a key part of what we need to do. And clearly, it's going to be important for us to involve citizens in helping us to shift the narrative in thinking that if we are going to improve health, we need to focus on health services, when the reality is that healthcare only accounts for about 10% of how health is generated in any given system. In fact, if you are interested in improving health and well-being, you need to focus on those wider social and structural determinants, and therefore citizen activation and experts are critical. So we're operating in an environment where the role of the citizen health expert is evolving, and there's some fantastic opportunities available for us today. Many of you are aware of the role of social media, which has the benefit of connecting people, raising awareness, and has become a fantastic channel of engaging communities and affinity groups around major health challenges and bringing that voice of the community and the public back to the center of policymaking. We've seen the role of online petitions and other ways in which digital and social media are supporting the rise in advocacy. And that advocacy is no longer coming from nationally funded community organizations, but we're seeing, from, as we've heard from a number of presenters today, the role of citizens organizing for themselves to deal with issues that are most important to them. The immediacy of smartphones, social media to spread the word, volunteering as the bedrock of community action, peer support roles, social movements, crowdsourcing, a range of methods and approaches which are now available for us to really think about how we begin and continue to engage citizens in health. Now, the theories and the understanding of the role of health expert continues to evolve, and in PHE we think of experts in a variety of domains, whether it is citizen engagement, the ways in which we are proactively getting people engaged in taking more responsibility for their health, the ways in which we're looking at engaging communities more largely and looking at the opportunities available through local government, the NHS, community organization, businesses, as well as communities themselves, to be part of that engagement process. Thinking about how we look at public engagement and using tools such as our national marketing campaigns, digital and social media, to begin to have different conversations about health with citizens and members of the public. So a range of these tools are now available to us, and Public Health England is committed to using each of these for a number of different conditions to begin thinking about how we improve the way in which we have bi-directional conversations with members of the public, full engagement of members of the public with the work that we're doing and the approaches that we're implementing to improve health. Now, certainly in health and care services, we're seeing the rise of the use of citizen health experts, and many of you are aware of expert patient programs, the work in NHS around patient activation as part of the 5-year forward view, and of course, in health care, the movement around personalization, personal health budgets, and co-production. Again, different approaches for engaging citizens as health experts. Now, in PHE, we have been developing a specific program of work about engaging communities and looking at place-based or community-centered approaches to engagement. And we've been doing this in partnership with our colleagues in local government and the NHS. And the key theory and the key approach here is mobilizing assets within communities to promote equity and to increase people's control over their lives. And we've been using these approaches to strengthen our work in mental health across the alcohol, drugs, and tobacco portfolio. More recently, we've been doing some new work in reconceptualizing gay men's sexual health and thinking about ways in which we can use community-centered approaches to help us in this regard. We've published a number of reports recently on community-centered approaches to health and well-being. Many of you may be aware of the briefing that was published last year, prepared in partnership with our colleague, Dr. Jane South. And really, this resource brought together the theories behind different approaches to community-centered interventions for improving health and well-being, ranging from work which is evidence-based around strengthening communities, promoting volunteering and peer approaches, through to collaboration and partnership, as well as access to community resources. So if you haven't seen this resource, I'd really encourage you to view it. The link is here on the slide, because this does set out and integrates the range of evidence-based approaches that are available for us for engaging citizens as experts in health. And the theory is absolutely clear. The more engagement that you're able to invest in and support is the better you will have a range of outcomes, whether it's service outcomes, intermediate social outcomes, or the health outcomes. And we have in the documents been very clear about various levels of ambition as far as engagement is concerned, moving from informing individuals through to consultation, to co-production, delegated power, and community control. So really moving across that spectrum to yield a range of better health outcomes. And again, this forms part and parcel of the work that we're doing in PHE. So as we move along this path, we are, as a public health agency wanting to understand, is this potentially a role for everyone? Is there a citizen health expert in all of us? And if there is, what role do we play in supporting the development, supporting and building the capacity for health experts? And it's clear that not all individuals are going to find it easy to participate in health and in health conversations and narratives for a variety of reasons, whether it's lack of health, life chances, or disempowerment. And so we have a responsibility, we believe, to work with partners to ensure that we are building that capacity and capability, that we are giving opportunities to engage more people in health and as experts, and providing the motivation for people to get involved as well. So again, this is part of the work that we're now doing in Public Health England, and we're basing this on what we now understand are varying, the model of behavioral change that we adopt and promote in Public Health England, which at its core focuses on building capability, opportunity, and motivation for more individuals to become engaged as health experts. So, just to give you a sense of how things are organized in PHE, this is our public engagement strategy. We work with a range of groups and committees which actively involve members of the public, both as representatives of the public, but also in their own right as citizen health experts. We host a lot of discussion groups, workshops, and consultation events on a variety of topics, again, to ensure that the public's voice, perspective, and narratives are included in the work we do. We actively run a public opinion survey every year, which gives us a sense of what the public thinks about the work we're doing in PHE. It identifies ways in which we are engaging with members of the public and what they would like to see of us as a national public health agency. And we also have a people's panel, which has more than 150 individuals, which are taking a representative sample of the British public, who are selected, trained, and supported to provide input into the work that we're doing in PHE. And we use members of our People's Panel on advisory boards, on a number of program boards that again helps us to ensure that whatever we do is connected to improving the lives and well-being of individuals. So you can see that there's a clear governance here for how we're engaging members of the public in the work that we're doing. And a key part of this, again, is building the capacity to create the next generation of citizen health experts. So there are a range of examples where we've been using the People's Panel as well as our colleagues on members of the public in our work. I just have here a few examples. Our Dementia Friends work, which was over the past 2 years, we've been running our Dementia Friends campaign in association with the Alzheimer's Society. And there was a pledge to recruit over 1 million Dementia Friends over a 1-year period. And the Alzheimer's Society has subsequently moved on to recruit more than 4 million Dementia Friends. And this was an initiative which both involved members of the community, those affected by living with dementia, to become part of co-creating this national campaign, but also involved in both the dissemination and engagement across sectors of the community in getting involved in dementia. And this was a highly successful campaign run by PHE and the Alzheimer's Society, and really created and provided new ways for us to think about the role of citizens in co-creating national campaigns such as this. Many of you are aware of the work that we've been doing in Public Health England on e-cigarettes. This has been a highly controversial space for us to be in as a public health agency, and many of you have probably seen that I have been quite vocal and open about the role and opportunity of e-cigarettes for harm reduction, but ensuring that everything we do is based on the best evidence. And PHE, exactly a year ago, released our evidence review on e-cigarettes. And I think the key thing for us in PHE was recognizing that the role of e-cigarettes has been a consumer-led phenomenon, and one in which we have to recognize the primacy of citizen health experts in this space. And I was so pleased to hear the first presenter this afternoon, because it is building upon what we know about citizen activism, which will help us to ensure that the best science continues to inform policy, that will continue to challenge policymakers to look beyond stigma and discrimination, to really focus on how do we use the tools that we have available to us to improve the lives of individuals. So in a lot of experience over the last year, as I've been working on e-cigarettes, it has reminded me of some of the debates that we had at the beginning of the HIV epidemic when we were trying to implement policies related to harm reduction to prevent the transmission of HIV. So again, the importance here of engaging citizen activists, focusing on the best science, and ensuring that we continue to challenge scientists, public health experts, and policymakers based on the best science as available. Finally, another great example of citizen engagement is the work that's being done across the country on local health champions, where we're looking at members of the public being trained and using their own experiences to help to transform health and well-being in their own communities. And health champions have been fantastic as a resource to really help to empower and motivate members of the community to get more involved in their health, in health and social activities, and to help to signpost people to the appropriate support services. We're learning a lot about using and supporting local health champions, and this certainly is being increasingly used across many local authorities and in many communities across the country. And I think the key challenge we have here is how do we ensure that this approach is valued, it continues to be invested in, that we continue to evaluate so that we can begin to build upon and continue build upon the lessons that are being learned as local health champions are being used across the country. Now, I think the penultimate slide was a video that I was going to show, but in the interest of time, I'm going to skip that. So if you could go to the next slide, please. And just to conclude the presentation, which is really just to reinforce that for us as a public health agency, citizen engagement is a core part of what we aim to do in Public Health England in our mission to improve the health and well-being of the nation. We have a proactive strategy and we have a proactive governance structure to ensure that we continue to engage members of the public. But we need to go further than this, and we're releasing policy guidelines to help localities to adopt community-centered approaches to improving health and well-being, and a core part of that is looking at methodologies for improving and supporting and building the capacity of citizen health experts. And in closing, I think what I really wanted to reflect on is, at the end of the day, we are public health professionals, and we are the servants of the public, and there are times when we will get it wrong. And I think we need to be humble in understanding when we're getting it wrong and being open enough to say, okay, how do we listen to alternative voices? How do we ensure that there's that diversity in the inputs that we're receiving so that we can become better at developing and evaluating and building on health policy? So with that, thank you so much, and hopefully we'll have time for a few questions. Thank you.